Thank you all for coming. Thank you, Maggie, for that lovely introduction. I'm Troy Flaherty. I work in the Center of Education Nursing Lab, but we call it the Simulation Lab. And I've been there for about 2.5 years, and I got to see things from both perspectives as a professor or teacher and as well as a student. Now, the Simulation Lab is a place where students get to come in and practice not only skills and scenarios, but full-blown simulations where they get to take their critical thinking and apply it into real-life scenarios. Now, as nurses, though, we're not only prepared to apply those skills in acute care settings, but at any drop of the hat, at any moment. Now, let me tell you a story about what I mean by that. I was flying to Mexico and was really excited to take a very luxurious vacation for the first time ever. And as I'm sitting on the airplane, an overhead page goes off. Is there a medical provider on the airplane that can assist us now? And I think to myself, oh gosh, that's me. I better get up. So I stand up and I walk down the aisle and I see a load of people staring at me. I have stewardess and flight attendants who are screaming for assistance. I have a very anxious wife who is screaming as well, and her husband, who's in his late 70s, passed out, white as a ghost, and completely sweating head to toe. I'm nervous, I'm anxious, but as I've learned in my nursing career and from simulations in the learning lab, that I took a big deep breath and I dove in. I checked his airway, he's breathing, thank goodness. I check his pulse, it's kind of there. And then I check his blood pressure and it is in the toilet. And I think, okay, I need to save this man's life and really decide, as everyone's yelling, should we land the plane, should we not? I ask his wife for some information. She tells me he's a diabetic. He had not eaten that morning, and they were on an early morning flight, and he was, had not taken any medication as well. So we check his blood sugar, and it's really low. Long story short, we give him actually some orange juice, which helps bring his blood sugar up. And about 15 minutes later, he comes to, and he's okay. And we don't have to land the plane, and everybody gets to Mexico safely. So we're okay. Now, that scenario is actually something we teach our students in the simulation lab. And it's really vital to their critical thinking and for them to be able to practice in all types of real-life settings. So as a mentor taught me, common things happen commonly. And that is one piece of the puzzle. Now, our students, and many of you know, there's a nursing shortage across the country and across the world. And that nursing shortage is causing us to have problems with getting clinical placements. Research has shown that we can actually do clinical hours in a simulation setting and replace that with actual clinical care at like an acute care hospital setting. That means right now, though, our students are only getting 13% of their total hours in the simulation lab. And we want to increase it all the way up to 50%. And many of you have heard that we've gotten funding to expand the simulation lab, but that funding only is enough to tear the walls down and barely put them back up. That does not include any equipment, it does not include AV equipment, and so today we're asking for funding, this investment to come into our simulation lab specifically for one piece of the puzzle, which is a mannequin that we want to incorporate. Many of you who have been in the simulation lab have seen a mannequin. Her name is Noelle. She's a birthing mother, and that's all she does. She just gives birth. But many of you know a birth is a complex, difficult situation, and not everybody has a natural, healthy birth. So we want to upgrade Noelle to a newer model and a newer system where she will give things like breech births, hemorrhages, C-sections. So not only will our undergrad students use her, but our grad students, our midwives, and then all other interdisciplinary will come in. So our physical therapy students will come in and work with her, and other departments like that. We are asking all of you to come into the simulation lab because right now you can actually see where your investment's going to go. Noelle runs on a crank system currently. You can imagine that, trying to give birth with a crank. So it makes it really hard for students to feel like they're in a real life scenario. Now we want to upgrade Noelle and other few things, and if you come in, you can see her now and you can see what she's going to look like later. So if all of you would come in, we're up on the 6th floor in the School of Nursing, and you can come look at all of our equipment. You can see what our students do, and hopefully we can bring back the real life situation that our students deserve and give them the education that they need. Thank you very much.